Welcome to this introduction to safety huddles. To improve safety in SLAM, teams have been implementing safety huddles to unite and improve daily communication with a focus on safety concerns. The purpose of this short video is to support you to understand how these huddles could equip you and your team in identifying and planning for potential safety issues, which could include risks to patients, staff, and the environment. Safety huddles are a short, multidisciplinary, focused exchange of information held regularly throughout the day to highlight current safety risks which may affect patients and staff. They can be held face-to-face or virtually to ensure everyone working on the shift are able to contribute. Safety huddles are used in both inpatient and community mental health teams and help to improve both staff and patient safety through regular information sharing, collaborative team working, and awareness of preventative actions to take forward. Held for no longer than 15 minutes, they help to capture and plan for emerging concerns such as safer staffing numbers. The best safety huddles are a quick get-together involving the complete multidisciplinary team, including administration and domestic staff, and providing them an opportunity to introduce themselves and to raise any safety concerns with a focus on action planning. On an inpatient ward, the huddles can be held every shift. For example, during the early shift at 9:30 a.m., during the late shift at 4:30 p.m., and during the night shift at 10:30 p.m. Within community mental health teams, safety huddles are useful at the start of every day. They can also be held as and when needed. What does a safety huddle look like in practice? Let's take a look.
Hi everyone, I'll be the facilitator for our safety huddle today. Firstly, can I ask everyone to introduce themselves and to tell us if you feel safe today? I'll start off. I'm Emma, I'm one of the support workers and I feel safe.
Hi everyone, my name's Aideen. I'm the OT on the ward. I'll do the scribing today. I feel safe.
Hi all, I'm Becky, consultant psychiatrist. I feel safe.
Hi, it's Chris here. I'm a bank staff nurse. I'm safe and it's nice to meet you all.
Afternoon everyone, I'm Georgia, I'm the charge nurse on shift and I feel safe.
Hi everyone, I'm Sasha and I'm the domestic on the ward today. So Alex has been making me feel slightly uncomfortable and a little bit unsafe, if I'm honest. It's important to allow all staff to introduce themselves, especially if they are new or a bank shift worker. By enabling everyone to speak up about how safe they feel, we will ensure that everyone is supported.
I'm so sorry about that, Sasha. Can you just tell us a little bit more?
Yeah, it's just that, I've noticed him pacing up and down the corridor quite rapidly this morning, and every time he passes me, he just stops and stares at me with this aggressive look on his face.
Is that Alex in room 3? I've also noticed him pacing the corridor and slamming his bedroom door.
His leave has actually been cancelled. He's currently got a DASA score of 3, but we've agreed some small steps for him to take to get the leave back. So I'll review him tomorrow.
I'll have a one-to-one with him just to find out a little bit more about what's happening at the moment.
I'm also planning an activities group at 3 in the therapy room. So Georgia, would you mind mentioning that and I'll bring them up later?
Sure.
Also, Dr. Vic's coming in 15 minutes to review his medication. So let's consider PRN should he become more aggressive.
Great, thanks everyone. Sasha, how are them actions? Are they okay?
Yeah, definitely. It sounds like a plan. Thank you.
Good. Please do let us know if there are any further concerns with Alex and if any of this behaviour continues.
Yeah, will do. Thanks. By exploring the safety issue immediately, we ensure that there's a focused discussion on what is causing the problem and what actions are required as a preventative measure.
Fantastic. Are there any other patients who may be disappointed, frustrated, or worried on this shift?
Could everyone please keep an eye on Sam? He's become unusually quiet and keeping to himself since we told him that his grandmother's in hospital.
I'll give his mum a call and see if we can arrange for him to phone his grandmother either today or tomorrow.
And I'll just encourage and prompt the rest of the team to proactively engage with him.
Thanks all. Please do keep an eye on him and keep me updated if you need anything from me.
Brilliant, that's great. Thank you, everyone. Are there any other safety concerns for our shift? Okay, good. In terms of actions, I just want to review them so we all know what we're doing. So for Alex, Dr. Becky will review his leave tomorrow. And today, Dr. Vic will review his meds. Georgia will hold a one-to-one, and Aideen will involve him in the group activity at 3. And then for Sam, Chris is going to give Mum a call and ask about phone call for Grandmum, and Georgia will encourage proactive engagement.
I've got all those actions captured, so I'll email them around the team now.
Lovely. Thanks, everyone. Really appreciate that, and have a great shift.
The action document must be completed during the huddle itself and circulated to the team to ensure everyone is aware of what the actions are. As you saw in the example video, the scribe captured all concerns and actions agreed, which you can see in this image. This is so that the wider team who are unable to join the safety huddle are aware of the issues raised. This document should be circulated to the whole team. There are many other ways safety huddles can help. For example, it's a great opportunity for new team members or bank shift workers to be introduced to the team and to understand the safety climate. A high rise in staff shortages can be raised as a concern with potential to impact safety. With COVID infections rapidly increasing or a high number of patients on the ward infected, actions can be made frequently to manage infection control, with ongoing violence and aggression or restrictive practice concerns. With this being said, how do you think huddles can help you and your team? Before we finish, here are some top tips to help you as you implement safety huddles. Firstly, it may be useful to be aware of your data, as this will highlight how often you have safety-related incidents. Everyone and anyone working on your team can join the huddle and contribute openly about what may be concerning them. You do not have to wait until the next scheduled safety huddle to call a get-together. Safety huddles can be called at any time if there's an immediate concern or risk. And finally, remember that open and honest communication, applied with the ability to speak openly without fear or judgment, will promote and enhance safety culture.